Patient was lying down on an operating table with his right arm hanging down for 3 hours. After he woke up, he complained of numbness and weakness in the right hand with the wrist drop and sensory loss over the dorsum of his hand, weakness of extension of the fingers and loss of sensation at the web of thumb. Which nerve is most likely damaged? This would be radial nerve, which travels in a spiral groove around the humerus. If your arm is hanging on the operating table, there would be pressure on the radial nerve around the humerus. See, look at the wrist drop and the sensory loss at the web of the thumb, which is caused by radial nerve. An old man with lung carcinoma is undergoing chemotherapy. He now complains of double vision while looking to the right. Which nerve might be involved? The answer would be right abducens, which controls the right lateral rectus. See, that is why his right eyeball is not going laterally, and hence he gets double vision while looking to the right. So obviously he must be now getting a metastasis. 67-year-old man with chronic arthritis presents after falling from stairs and now complains of loss of sensation in his little and ring finger. Which nerve is most likely involved? It will be ulnar nerve, looking at the sensory distribution affecting the little finger and partial loss in the ring finger. On the palmar aspect of the hand, the 3.5 digits from thumb side are innervated by median nerve, and on the dorsum of the hand, the same 3.5 digits are innervated by radial nerve for sensation, and ulnar is innervating sensation for little finger and half of the ring finger. Motor component of ulnar nerve damage will lead to claw hand. 22-year-old man has reduced consciousness level and a fixed dilated pupil on one side after being involved in a motor vehicle collision. Choose the single most appropriate nerve which is involved. Answer would be oculomotor, third cranial nerve. There is no feature of facial nerve, trigeminal nerve or olfactory. Optic nerve will give rise to blindness or a non-reactive pupil, but here third nerve palsy is also called as a false localizing sign. 67-year-old man after a stroke presents with left-sided ptosis and constricted pupil. He also has loss of pain and temperature on the right side of his body and left side of face. Which part of the brain is most likely affected? Answer is medulla. If patient has cranial nerves affected on one side and limbs affected on the opposite side, always think of a lesion in brainstem. To further localize, this patient has lateral medullary syndrome as only pain and temperature fibers are affected. If this patient had loss of all sensations on left side of face, we could have said pons, because the fifth cranial nerve comes out of pons. But this is dissociated sensory loss and hence lateral medullary syndrome. Please read up about this syndrome. A woman comes with an ulcerated lesion 3 cm size in the labia majorum. What is the lymphatic drainage of this area? It is superficial inguinal lymph nodes which drain the vulva, scrotum, lower vagina, but not the penis, not the clitoris, which go into the deeper inguinal lymph nodes. So the answer here was superficial inguinal lymph node.